Right, I'll start off. I'm just going to share my screen with the PowerPoint presentation. I mean, all of you know who I am. I'm Jit Parekh from the engagement team. So I'm going to talk you through the PowerPoint presentation around messaging. Can everyone see that? Yeah. Okay, so the main purpose of today is looking at the hyperlocal work in partnership with yourself. But the main thing we're talking about is the pressures in A&E. Just the agenda, just very quickly. Just want to welcome an introduction. We'll do that in a bit. Then we will talk about joined up working with other VCS groups and partners. We'll be talking about toolkit and messaging, where myself and Melanie will be going through some of that. We'll also look at what else do you require? Is anything we're missing? Anything you want that might be particularly that you need for your community? And then we'll talk about next steps as well. So first of all, I just want to set the scene. You've all seen this quite a lot, but I just wanted to make sure we have a focus on why we're here and what we're trying to do. The postcodes on the left and the map, you've seen that in the bid. This is where we're getting the most inappropriate sort of use of A&E. Inappropriate means they have turned up to A&E and they basically didn't really need to be there because another service could have provided them with whatever their symptoms once triaged. And the postcodes we're looking at are LE1, LE2, LE3, LE4, and LE5, and the coverage of the areas within those particular postcodes that we're looking at. And then just wanted to focus back on the aims and objective. The main aim, what we're trying to do is to prevent illness and injury. We're trying to support as many people with their own health in their own environment. But also at the same time, we also want to raise awareness of how to access local services, how and when it is most important. And also to raise awareness of what to expect if people need to receive care. And the targeting will be around the population that we're outlining, which is the families, babies, young children under the age of 10, people with the age group of 21 to 30, young professionals, but also young professionals and people with a young family, children under 10, homeless, refugees, asylum seekers, Eastern European, Central European and Black, Asian, minority ethnic communities, and groups with particular barriers to healthcare access. So we're looking at a group of those target population, and some of you are going to be looking at these with your particular organizations. So if I can stop sharing for a while and just wanted to go around the table and just introduce ourselves, as if you could all introduce yourself one by one. I'll go first. I'm Jit Parekh from Communication and Engagement team, working with Joe on this project. Melanie?
Hi, yeah, it's Melanie Shilton. So I work in the same team as Jit, so in the ICB Communications and Engagement team. So my role's around, say, communications, campaigns, and yeah, behaviour change.
Andrew, I'm just going from how I can see people.
That's fine. So I'm Andy Ward. I work at Leicester Medical School. I also work as a GP at Inclusion Healthcare in the city centre. And our bid was with Project Light, which is a charity. We get medical students to help homeless people. So they go to the bridge and places and give food. And they're going to be educating that community on how to use healthcare more effectively, hopefully.
Thank you, Andrew. Eric?
Morning, everyone. My name is Eric Kwaweru. I am with the Center Project, which is a charity based in the city center, and we work a lot with people across the city. But our focus this time will be most of our residents who are within the mile radius, and we engage with them on a weekly basis.
Thank you, Craig.
Hi, I'm Craig. I work for Silent Development Services. We support people mainly in the Highfields area, but also across the city as well.
Thank you, Craig. Anita?
Hello, I'm Anita, manager of Wesley Hall Community Centre. We are based in Spinney Hill area, and we also not only do the service for Highfields, but also across wider Leicester. We have activities for all age groups, starting from antenatal till elderly group. We have got under 5s project and also a food pantry and a food bank. Thank you.
Thank you, Anita. Barbara?
Good morning, everyone. Barbara Trzesznikowska, Project Polska. We work with Eastern European, mainly Polish residents across the city and county. For purpose of this project, we will be focusing mainly on city centre and identify postcode area, delivering some session to tackle some of the objective identified by JIT.
Thank you, Barbara. Tejo? Tejo, can you hear me? Okay.
Yeah, sorry, my daughter was using the laptop, so I think her name pops up. Yeah, so I'm CEO of Leicester Community Links. We provide services around well-being, particularly supporting mental health and keeping people active. So we're really keen to sort of reach out and work with communities to sort of connect with them and support them on a wider level in terms of accessing services and creating awareness on campaigns and cost of living crisis and any other issues which may affect them. We particularly work with communities in social deprivation areas as well, so and hidden communities, so we're keen to sort of engage with them. But yeah, we have a base in the Belgrave area, but we do work in Highfields and Evington as well, and with other community partners. Thank you.
Thank you. And last but not least, Lindsay.
Hi everyone, I'm Lindsay from Centre for Fun and Families. We're working on this project with Leicester Mamas. At Centre for Fun and Families, we provide group work and one-to-one support for children, young people and families with behaviour and mental health difficulties. And our project's around education, first aid, family health education for the parents of the under 10s, Eastern European community, BAME and asylum seekers.
No, thank you. Thank you for that introduction, everyone. I think it's quite important we get to know who we are and what we're doing, because there will be, I'll go into my slides later, there will be a lot of crossover in certain things that we're doing, and we want to make sure we share some of the resources, more importantly, methods and some of the materials as well. So I want to carry on with the presentation where we, I'm just going to go back to my slides again. Can you see all that? I presume you can. So this leads us nicely onto the next one. Now we've done the intro. One of the most important thing about this particular project is that we joined up our working with our VCS groups, and we've had the one-to-one calls with most of you now, where we've looked at a lot of crossovers or things you're doing, and all of you are doing something different in different ways, which is fantastic. I've tried to share that in almost a snapshot of what's happening. I'll just list a few of those: primary care videos and GPs and pharmacy. These are some of the tools that you're going to be using and the way you're going to be delivering some of the messages. Health talks, self-care events, family first aid courses, baby and toddler health videos, education sessions, first aid training, self-care community workshops, and peer voluntary training in accessing local health services. This is all going to be really rich in terms of what we're trying to do. We're not just doing one thing. We're trying to get through to quite a lot of the target audience using different types of methods, which is really, really good, because one thing doesn't work all the time. And this basically, the partnership we're working this across all of you guys as partners and individuals, which will give us far better outcomes, because we are using tools and materials which hopefully will give us the effective outcomes that we're looking for. Now I'll pass you on to Melanie, who will talk about the Getting to Know campaign and the messaging around that. Over to you, Melanie.
Thank you, Jit. So I just want to kind of talk about this campaign. It's something we launched back in November, and it's not kind of essential for you to use, but it, you know, you might find that it is useful when you're kind of out with communities, because it, you know, it does cover a lot of the messaging that we'd want to get across. So I just thought I'd introduce it to you now. So yeah, we launched it back in November, and the purpose behind it is to help people to get the right care as quickly as possible. So the first part of the campaign that we launched in November was promoting our information hub. So could I have the next slide, Jit? Thank you, which is here. So there's a website, getintheknow.co.uk, which has got kind of like links to all the different services. So that I suppose the key things from it are, you know, this is kind of what you do if it's urgent, which is basically the 111 and the 111 online message, and then kind of a set of things if you have something minor. So there's basically 3 things that we'd want to promote for minor illnesses and injuries. So 111 online again, the NHS app, and local pharmacies. So there's also kind of other information on the website as well. So things like using GP practices, mental health, children's services. So it's designed just to be kind of a bit of a one-stop shop really for where people can find out you know, kind of, you know, what the local services are. You know, it's something they can either use when they've got an immediate need, or something that they can, you know, kind of learn about and, you know, hopefully keep coming back to. Get the next one, please. So yeah, there's a few different themes of the campaign that we've kind of run over, you know, since the initial launch back in November. So we did a bit of a focus on mental health. Minor ailments was the next one. Obviously there was a bit of a Christmas campaign about kind of what's open over Christmas. GP practices, you know, and how to use them. Could I have the next one, Jit? Yeah, there's a few different GP practice messages. So things like, you know, what the GP practice team consists of, things like different types of consultations, so phone, video, or online, online services. And then the last one that we've launched kind of back in kind of January is around the 111 online. So that's the kind of key message for what to do if it's urgent. So so to go with all of those, so we've got a whole load of different assets for each of those different themes of the campaign that, you know, might be useful to you. So there's a load of digital assets, and there's a link to our toolkit there, so where you can kind of download everything directly from that web page. So there's things for different types of social media, things to go on websites, digital display screens. We have got other stuff as well if you know, there's things that you think that you need. There's also literature, I suppose, so posters covering all of the themes in kind of portrait and landscape format. We've got a brochure about how to use GP practices, a couple of leaflets, so one for the minor ailments and what to do if it's urgent, a couple of audio adverts. So all of this is currently being translated into the languages I've listed there on the slide. So we're expecting things back from our translation agency kind of imminently. So they will be kind of available to you in the next few weeks. We're also taking orders for printed material. So there's a link on this slide. So I'm assuming, Jit, you'll send these out to people afterwards. So yeah, there's a link there where you can order, so you can see all of the printed materials that are available, and you can order in the different languages. So yeah, if you could fill, you know, if you do want anything, just, you know, just kind of fill that order form in really, and we can, you know, if they're useful, we can, you know, we can get them to you. I think that was my last slide, Jit. Yes.
Okay, well, thank you, Melanie, for that. That's very, very useful in terms of what's available and what's happening at the moment. So
you know, I suppose the thing to say is, you know, it might not be relevant for what you're doing, or you know, for the audiences that you're engaging with, but you know, it can say there's a lot of stuff there that, you know, that you can use if it's useful.
Yeah, no, thank you, Melanie. Thank you for that. So we did talk about the specific audience when we had the conversation with quite a lot of you. we wanted to actually take you back. Let's not really jump into all of the stuff, because some of the communities who've arrived, they don't know what NHS is. They just, NHS is NHS at the end of the day. This is just to give you an idea of NHS history when it was created, where we are now. And it is it's a long held ideal that healthcare should be available to all, regardless of wealth. So this was the terminology for NHS. Anybody can actually access NHS. But what is the NHS? Because when you put the NHS logo, people would assume it's the hospital. First thing they'll think, NHS is the hospital. But little do they know the GP surgery, pharmacy, there's community health services, there's mental health services. There's a lot more other services provided by the NHS. But the people who've arrived into Leicester from different countries will just know the hospital scenario. And it's important that we explain how the NHS works and different types of care that you can get within the NHS. One of the key things we wanted to break down was to actually simplify some of the messaging that we put across. As you know, with urgent and emergency care, there are a lot of options available. And we're trying to simplify it. This is exactly what Melanie was saying earlier, where we're trying to make sure that people are not getting overwhelmed with a lot of information. But we wanted to make sure we go through the pathways of how things should be accessed. Self-care comes first, pharmacy, GP, and NHS 111. These are sort of the scenarios where we want to get more and more people to actually use that type of sort of process that they go through. The slides, I'm not going to go into too much details, but we've simplified it by telling you what self-care is. What is self-care? What do you need to do when it's self-care? And simple things like cough, cold, stomach upset, sore throats, headaches. But also the key essentials of self-care is having a sort of first aid kit stocked up, having the right medication in your first aid box. And it's just to explain that it is important to have that, because at the end of the day, this is one of the essential part of being self-care, because if they don't have this, it escalates it into becoming something quite serious, which could be resolved by taking paracetamol or using some of the medication you've already got in your first aid box. The other option is pharmacy, but we position it as chemists because a lot of people understand it as chemists. So we need to use the right terminology sometimes of how we're talking to some of our target audience, especially with the pharmacy being in the community. It's more visible. It is more accessible as well. You can literally walk into any pharmacy, more or less. And in most cases, you don't need to make an appointment. And within the pharmacy, they can really give you a lot of information, which you don't realize. The pharmacy is trained to a good standard. He or she is a health professional and has had a lot of training in terms of giving you that advice. A lot of people probably don't know, but every pharmacy, more or less, across Leicester, Leicestershire and Rutland, mainly Leicester City, have got almost a consultation room where you can actually get advice from a pharmacy with minor illnesses, ailments or injuries. And they will be able to advise you what to do next, because if they feel that they need to send you to a GP, they will tell you. If they feel that they can actually treat you there and then, they will treat you there and then. And there is other services they offer, which a lot of people don't actually realize, that pharmacy offers a lot more services, health services, other than most people's perception is prescription. You go there, pick up your prescription and you walk out. But little do you know that they'll offer a lot more services, from emergency contraception, health checks, chlamydia screening, stop smoking. There's a lot of other things, blood pressure checks, and they are expanding their services as we speak, because they are becoming almost like the hub in the community where people can go. And the other thing is that they are open longer hours in most places as well. I mean, you've got pharmacies in supermarkets now, which are open far longer than where you can actually go on the high street. So there are a lot of opportunities of access for pharmacy, and we are asking people to actually just get that reassurance. I think that's what people want sometimes. They just want to make reassured that it's nothing serious. They could pop into a pharmacy to actually just ask them, say, look, hold on, I've got this rash, I'm not sure, what do you think it is? And they can reassure you, and it could be anything really. So I think we need to really work with some of the messages around the pharmacy. GP, as you know, it is very busy times for GPs, but they are accessible. A lot of people are putting barriers saying, oh, it's really hard to get hold of a GP, but they are available in different formats. Online, they do online consultation, they do video, they're also available face-to-face, and a lot of practices, in fact, all the practices have some form of a practice nurse who often is over sort of thinking, a nurse, why would I want to see a nurse for? But the nurse can actually give you a lot of information and support, which could help you with quite a lot of the minor stuff. And if it is urgent, normally a practice nurse will refer it to the GP straight away. So you're not double booking again, where you've seen a practice nurse. You don't have to go and book. If he or she feels that, hold on, this is quite urgent, I need to grab a GP to go and have a look, they will do that. So we need to really look at how we can actually utilize the practice in the most effective way. And they, as again, is a really good center point where you can actually go first to get some advice and in more cases, advice and reassurance, really. The next one is a really big one, because NHS 111, it is 24 hours a day, 365 day. It's free of charge, mobile, landline, online, whichever way you want to use it. And it's quite quick and easy to actually use. But the other interesting thing on here, which perhaps you might not know, you might know already, they do offer translation services as well. So you can request the language you want to speak, and you can actually have that offered to you by asking for that very clearly. The way the NHS 111, you will get triaged when you basically go in. They will ask you, they're called algorithms, a set of questions which are set by GPs and clinicians to make sure they identify what is the problem, how serious is your problem, and how quickly do you need to be seen, really. And I'm not going to go through every single element, but they will direct you into the right care, basically. So if it is urgent, they will call 999 and get the ambulance for you at the end of the day. But if they feel that it could be seen at an urgent care centre, or it could be seen at another health service and health provider, and it could be your GP or even other areas, they will advise accordingly. And in more cases, they will book it for you. So you'll go in there without actually walking in. It'll be organised and done for you. I'll talk a bit more on that when we go to the next slide, which actually explains how does NHS 111 work. So if I can look at this bit, this is where you call. And again, for our audience, we want to reassure them that there are translation services available, because the biggest barrier is communication sometimes, to explain yourself, what's wrong with you. So that element is available, and we need to get that across to a lot of the general public that we're talking to. And then once you call, there is a triage service where they will ask you a set of questions where they will identify what type of service you need. And as I said to you before, if it is a really urgent emergency, they will call 999 and get that ambulance over to you. But after you've been triaged, you could be directed or forwarded onto the following services, right from self-care, pharmacy, dental, urgent care centres, minor injury, GP, out of hours. There's a variety of services available. And it's important to just get that idea of understanding how it operates, really. And the other thing, sorry, just to go back, because there are so many choices that you've got, and it's just 111 trying to take those choices away from you, and they will make those clinical choice for you based on your symptoms, really, which is really, really important, because a lot of people assume they need to go to A&E or they need to go there based on their symptoms, but 111 can be that particular place where they could actually advise you in the right way, so you're not bounced from one place to the other. You will go to the right place once they triage you. The other thing we need to remember is emergency department, A&E, is actually a life-threatening accident emergency only. And these are really, really important. You should only go in there if you are suspected heart attack, stroke, loss of consciousness, heavy bleeding, breathing difficulties, severe bond fits. These are life-threatening. So this is what we really, really need to remember, that the ED or A&E was designed for that particular purposes. And it wasn't really designed for everything and anything, really, which in some cases people are using. We really need to emphasize that A&E is important. And it is important because we want to make sure the right people are going there so they're getting the treatment quickly, especially life-threatening conditions. So I'm going to stop there. I'm just going to pause for a minute. going to stop sharing. So that was just to give you a quick summary of what we're trying to talk about in terms of the messaging. This all will be available to you. Just want to stop and pause and say, what other things do you think you will require with what you're doing at the moment and the target audience you're trying to get across? I mean, this is open discussion now where we can just go around, and if you feel that there is other things you need, we will obviously try to see what we can facilitate, really. Or have we covered everything that you think you need, or is there other things that you feel that you might need further? Anita.
Yeah, hi. Most of the people who come to our food bank, they have not registered with GPs and a dentist. So is there any way how we can help them, like, because definitely they need someone, an interpreter, to go with them to register with the GP. So is it possible we have someone at Wesley Hall who will be able to help them to register with the dentist or GP?
I mean, we have Melanie. There was Prakash, wasn't it, who was working, and Hannah were working on trying to help areas within Leicester City who had low sign up of patients registered with the GP. So, Anita, again, let us take that back and find out what is the right thing we can provide you with. But I am quite confident we have got a lot of stuff available, and we have got a program which is working, and I can get back to you on that, Anita. But I can get back to all of you guys, because you might come across that with your target audience that you're working with, and at least you've got that information where how to actually facilitate in terms of signing new patients to GP surgeries and dentists.
I seem to remember though. So we had a load of materials produced, which kind of explained the process for registering with a GP. There is some information in the GP practice part of the Get in the Know campaign. So we talk about in there about how to register. But yeah, as Jit said, we used to have somebody who their job was kind of helping people to register, but I'm not sure whether they still exist or not. So I think that's the key thing we'd need to find out.
Yeah. No, thank you, Anita. Andrew?
Just to say, Anita, I'll put a link in the chat for a website, Doctors of the World, that have loads of really good information for people who don't know how to operate the NHS, who've come to the UK, and they're all in every single language you can possibly think of. And they do a leaflet on how to register with a GP, so how to find and register with a GP, and why you might want to do that. So I'll put a link to that leaflet in as well for you, Anita.
Thank you, Andrew. Yes, I mean that is the whole purpose of this, is we're working in collaboration, that you might come across things that might be useful for everybody, and this is a good platform to actually share it, not just today, but just generally we're going forward. If you come across anything new, or you want to, I don't know, you come across and say, well, hold on, this would be really useful to have, then please let us know, because we're basically, you are our eyes and ears on the ground, because at the end of the day, we're producing things which we feel that is needed in the community. But you might be able to find different things, and you think, well, hold on, Joe, Melanie, we need this, and that. So we'll keep this sort of conversation open, where we just need to get that feedback from you. And if there is anything particular, then please do let us know. And even from a health professional point of view, if you need a health professional, that you feel you need somebody to come along, and if you're doing a big event, then please let us know. Just talk to us. It doesn't have to be a massive event, but it could be targeted. So just talk to us, really, at the end of the day, and we will try to facilitate where we can and help you, because we want to make sure that you're getting the right information, and more importantly, from a trusted source, which is the most important thing. Anybody else? Okay. Right, I'm going to move on to my last slide. So share. So that nicely brings us on to our next steps, what we need from you, and what we are going to provide. So Joe will myself and Joe are meeting up later on today. We have got the SLA all confirmed. We're just going to send that across to you all individually and get that signed. We've also got the template for the invoices already. We're getting that sorted as well. So we want to get that submitted. We will start looking at various toolkits that you will require digitally or printed. And as Melanie kindly has offered, if you do require anything printed in different languages, please let's use that link. The sooner you get that in, the better, because then that material will be available in different languages that you require. Again, I will email that link separately. I will share the slides, but I'll email it separately as well. So you've got that access to that printed materials if you require. And we will also share this slide as well. We will be doing a midway review as well with all of you, one-to-one, where we'll be sitting down and looking at how things are going, what are the barriers, is anything else you need to get things moving. But you don't really need to, personally, you don't really need to wait for the midway review. I really think that if you feel that there is certain things you need and there's barriers, please talk to us straight away. Let's not wait for the program to finish, more or less talk to us continuously. But we will have a midway review and just look at how you're getting on according to the activities and outcomes that we've outlined. We will be sharing an action plan, which we would like you to record all of the outcomes. It's almost, I wouldn't say a heavy weighted KPI, but it's more or less capturing all of the stuff you're doing. More or less, we need that from a sort of reporting point of view to see that everything is working, and if there is anything else you need from that as well, we can review that together. The action plan is a joint effort. It's not just us, it's working with you with that plan to look at that. So those are the things that we're going to be sort of working on in the next couple of days. You'll be seeing quite a lot of the invoicing, SLA, toolkit, action plan coming across to you. And then we'll do another session as well, where we will look at how you're getting on with the launch, the start, and anything else you require really. I'm going to move on to the last one, which is if you've got any other further questions or anything that you're not sure of at the moment, that we can sort of take on board and take it back. Lindsay?
Would it be possible to have a summary of what everyone's going to be working on and who with, and contact details? Because I know when we met, Jit, you were saying that there was probably some crossover with, sounds like Andrew's project and Barbara's project. So it'd be really good if we could understand what that might look like. And obviously if there's, you know, any interest in what we're doing, or you've got populations that are ready for our sort of stuff that we could signpost people into.
Yes, no, we're definitely doing that, Lindsay. That's one of the part of the thing where we'll be sharing with you some of the common things that people are doing, but more importantly is utilizing the resources as well, where we don't want to repeat what you're doing, somebody's doing exactly the same and so forth. So we will be sharing that almost like a summary on one document, giving you a highlight of what people are doing and what materials they're using and the methods and all of that. So that should be able to give you that, I will almost say, cross-fertilization of people working quite smartly. And we've already had conversations with groups who are going to be working together. So we are going to be facilitating that as well to make sure that we get a what do you call it, a great understanding, rather than halfway through the project you find out somebody's doing X, Y, and Z. So yeah, we're definitely going to be doing that, Lindsay.
Lovely. Sorry, do we have any, I know originally we were supposed to have achieved all of this by the end of April, or by April, and obviously the timescales have changed a bit. When is midway? When's the end?
I think we are going to send that to you with the timelines, and in the action plan we will set out some dates in there, because we did start this later, and as we said to all of you individually, that this A&E is not a problem for winter, unfortunately. It's a problem all year round. So we want to, whenever you start, we will. So there are organisations here today having an events in June and July. That doesn't mean we stop. You facilitate that event and do it in June, July if you need to, because that is part of the whole awareness and getting that information out. Because we can't dictate the events around. There might be big things happening in summer so that you want to be part of, and this could be a really good way of getting a lot of message out to a lot of people. So we don't want to sort of restrict you from saying, right, that's it, you finish end of May and that's it. And when you've got a big event coming in June, July, and it's a missed opportunity, really. So we will send that, Lindsay, again individually to all of you with the timelines and when you start and the midway review is.
Thank you.
And Andrew.
Oh, it's just we were talking about this in our team here and thinking actually a lot of the stuff we produce for this could definitely be run again next year. And is it likely that funding will come forward again to do these sort of projects again next year? Will it be a competitive process again, or?
Yeah, I think depending on how we get on with this project in terms of the outcomes and how we feel that, I think I'm a great believer. Once you start something, I think we can carry that on because we've done the hard work. The next is just mobilizing the next stage. So there will be phases of this. So I can't really promise anything at the moment, Andrew, but I think, yes, that is our intention going forward, where we will want to carry on. If it's working well, then why would you want to stop it? Because if it's working effectively, then we would definitely want to have a interest of carrying this on really going forward. Eric?
In terms of resources, is it possible to give us a list of community pharmacists in the target area?
Yeah. Yeah, we can do that. That's no problem. Eric, I think what we probably will do is maybe even give you a list of all the GP practices as well in line, just to give you that understanding what local GP practices are there, because that will work in line with if you've got, Eric, if you've got people who want to register, at least you know where the nearest GP practice is rather than going. And so we'll try to facilitate and provide a list of both of those for you, pharmacy and GP practice.
We chuck in dentists as well, Jip.
That's
there is actually a search tool online. So on the NHS website, we've got it on as part of the Getting the Know website as well. So you literally put your postcode in and it brings up. So you can choose like GP, dentist, pharmacy, a few other like opticians, things like that. So yeah, there is a search.
Because I think the trouble with dentists is they're not always accepting new patients, are they? I think that's where they differ to GP practices. And that can be a barrier, and people can, speaking from my own perspective, it can be quite hard work to find yourself a dentist, even if you've got a good level of health literacy. So I can imagine if you hadn't, that would be quite difficult.
Yeah, no, I agree with you there. I think there is I think it's 2024, Melanie, I think, when dentist comes on board with the whole ICB sort of.
No, it's April.
Is it this April? Okay.
Yeah.
So we will be having some new changes in terms of access to NHS dentists as well. So we'll keep you updated.
I've just put the link to the service finder in the chat, the NHS one.
Okay, is there anything else anybody else wants to bring up while we're all together? Yeah. Okay. Melanie, anything you want to? Anything else you want?
No, nothing to add. But just to reiterate, if there's anything that you need, just to get in touch, really.
Yeah, definitely, and we will be in touch very shortly with all the stuff that we've just promised you. I think the important thing is that we just need that continuous communication between us, just to make sure everything is working for you. And if you need anything, I think I can't emphasize more. If you need anything, just let us know, and we'll try our best to facilitate whatever you need to help with whatever target audience that you're working with. But I think the greatest aspect of this is we're looking at economies of scale. So if you're doing events, and if you wanted to invite another audience which are similar, then it might be more effective going forward, because it's not worth doing separate events for 20 and somebody's doing a 50. If you put all of them together, together, you'll have a far better impact with some of the activities we were doing. I'm not saying for everything, by the way, because you might have to do certain focus groups, certain things that you're doing, but there might be certain events you're doing that we might need to sort of collaborate together to just look smarter, really, in the way we approach things. So that's all I can emphasize. But I'm really excited for you all guys on board, and looking forward to sort of sending across all of the SLA, and we'll get the invoices as promised. We will be paying you up front with this project. So that's one of the things that we've promised. So we will get that sorted out for you. And I just want to thank you for everybody who sent their details, bank details and everything. I think most of you we've got already. So we're going to get that process. I think it's almost there. We're just checking through the finer details, and then we'll be sending that all across and getting things moving. But no, I just want to say thank you for your time for today. Really appreciate your time, taking that time out. And I think we're on time as well. We said an hour, but we've done it in 45 minutes, which is fantastic. But have a good day, and we'll speak shortly, really. Thank
Good
you.
to meet you all.
Thanks.
Thank you all.
Thank you. Bye-bye.
Bye-bye.